Hello, my name is Bruce Spurlock. I'm a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. On Viral Healthcare, we explore the ideas and trends that are evolving in healthcare, what makes them work, what makes them not, and how to sustainably implement them for the benefit of your organization. So have you ever had one of those don't do it moments? You know what I'm talking about, when a little voice in the back of your head says, it's probably not a good idea, but it's so exciting, so tempting, we got to do it anyway. Well, that's what we talked about a little bit on this week's episode that I'm going to reflect on today. It was this discussion about, can we tell the difference, or do we have any early warning signs about this concept of hype versus reality? What are some of the clues and reasons why we actually adopt things that get a lot of hype, that have a lot of buzz going on, that we see at a ton of conferences or people are talking about in the halls of our organization? What is it about healthcare that makes us do these kinds of things? And the start of all of this is just the overwhelming volume of inputs, the overwhelming volume of information and decision making that we have to do on a daily basis. So many articles, so much research, so much new technology. I mean, one of the things that got me excited about healthcare was this idea that it was continually evolving. One of the downsides of healthcare is that it's continually evolving. And when we get the pressure of all of those inputs, we oftentimes take shortcuts in our decision making, in our thinking, and we do things like we trust somebody's reputation, or if it's a good brand, or things that would make us maybe not evaluate something as deeply as we want to. So if we're going to step back for a second and say, how are we going to be able to identify what's hype from what's reality? We need to just pause for a second and see, can we better effectively, more rapidly understand some of the red flags, some of the early warning signs we have? I mean, it's hard to do. And one of the reasons it's hard to do that, no matter what these warning signs are, is that leaders in healthcare are rewarded, are promoted, are expected to be decisive, to be action-oriented, to take charge. And sometimes the best thing to do is actually pause and slow down and step back. And yet that's not what gets really rewarded. I mean, this whole idea of watchful waiting that we have in some areas of healthcare, like let's see what something happens. It's just like sort of antibiotics for a cold. There's so much pressure to do something rather than to say, you know, it's really going to have about the same impact as we just watch it and see what goes on. So that's kind of the setting we're looking at. But what are the real warning signs that you have? Well, there's a couple of really big ones that I look at. When somebody uses the word like, this is transformational, these are end-to-end solutions, when there's this over promise of how things are going to change an organization, change the world, that's a big one. That one is like, you know, when there's promising too much, when most of the time we see incremental changes add up over time, those are some important ones. When there's this notion that you have to go with speed, that speed is crucially important in healthcare. You know, in fact, it's rarely important to think about deciding quickly, to adopt a new technique or a protocol or some kind of innovation, system, method, platform, whatever you want to call it that's out there. A lot of times people promote these things with, I would say, relatively weak evidence. It's evidence that applies in one or two places, or maybe it's not even evidence at all. I mean, there's like this 80-20 rule, or maybe 90-10 rule. When you go to presentations and you see slide decks, and about half the time they're describing the problem, about 30 or 40% of the time they're talking about like how they attack the problem, and then maybe 10 or 15% of the time they show you their results. That's pretty common to see those kinds of things happening. There's very little discussion on implementation. That's a big red flag. When they don't talk about the barriers and the challenges and the difficulties and the time about implementation, then you know that there's something to be done here, because these things just don't adopt across all different types of organizations well. They have to be adapted. And so spending time on thinking about that is really important. And finally, if they never talk about trade-offs, if they never say, you better stop doing these things because this has to be a priority, sometimes it feels like you can just layer these things on top of it. That's a big red flag for doing it. So if you're going down that pathway, just stop and pause and ask yourself, if we were really making a decision for the long haul, if we were really thinking about it, would we act this quickly? Would we put the pressure on ourselves to make these kind of decisions. It's interesting, when you first start doing this, you find that friction whenever you do a new intervention, a new innovation, is often highest early on. And if you're not feeling that, if you're not anticipating that, if you're not really expecting those kind of things to happen, it might be a sign that you ought to stop and pause, and that this could be something that's, is it Memorex or is it real? So this is Bruce Spurlock. I'm looking forward to our next episode. We're going to spend more time talking about the problem, the nature of problems. What are the problems we're starting to solve? Are they ours? Are they the systems? Or are they kind of a mixture of both ours and the systems? We're going to explore that in more depth, and I'm excited about that. So if you enjoyed this discussion, share it with a friend. Connect with me. You can reach me on LinkedIn. There's lots of ways to get a hold of me. Tell me your ideas. Ask me your questions. I'd love to have some of you on this podcast and discussing these things with us in the future. So with that, I'll say, see you next time.